Sydney was a beautiful, healthy, vibrant 17-year-old girl in Eden Prairie, a suburb outside of Minneapolis.
Syd was fearless. She was also pretty silly. She was quite a jokester, and she made everybody feel welcome, and everybody enjoyed her presence. A number of folks really appreciated her kind smile.
She just loved life.
Like millions of teenagers every year, Sydney underwent anesthesia in an oral surgery office for the extraction of her wisdom teeth in June 2015.
Dental anesthesia in the office setting is extremely safe, and complications are very, very rare. In fact, the overwhelming majority of oral surgeons and anesthesiologists practice anesthesia in a safe, judicious manner.
However, during Sydney's procedure, something went tragically wrong.
As soon as the receptionist came through the door, I was assuming she was going to tell me that Sydney was all finished. And she came up and sat beside me and took my hands and said, "I just want to let you know that Sydney's gone into cardiac arrest."
During the procedure, Sydney developed problems breathing. Normally, any problems would be rapidly detected and quickly treated. However, in her case, the oral surgeon was not using basic fundamental monitors such as capnography that would have helped detect her breathing problem.
Capnography is one of the means that we use for monitoring breathing. What capnography does is it measures carbon dioxide that we expire. As humans, we breathe in oxygen and we breathe out carbon dioxide. So capnography is critical in the operator anesthetist model because there is a separate alarm that sounds that immediately tells the oral surgeon that breathing has stopped.
Investigation also revealed that the oral surgery office staff had inadequate training and preparation for monitoring sedated patients as well as handling medical emergencies. As a result, Sydney's breathing deteriorated to the point she developed cardiac arrest. 911 was called and she was transferred to the local hospital. Despite her valiant efforts and the efforts of the medical staff, Sydney succumbed to the effects of having her brain deprived of oxygen, and she passed away on June 15, 2015. The passing of Sydney was a devastating tragedy and became national news.
You lose a child, you lose the future. And we just didn't know what the future looked like and how were we going to deal with this.
Sydney's story is especially devastating because had fundamental guidelines been followed, her death was completely preventable.
One of the mottos of the Galleger family is to never give up. I think that's really appropriate for us to remember as medical and dental professionals. And so we ultimately need to remember that we can never give up when it comes to patient safety, that we should try to do our best and follow the basic safety guidelines for every patient, every time.
The overwhelming majority of doctors and oral surgery offices practice in a safe manner, but even one tragedy is one too many. With vigilance, proper training, and a moral imperative that puts patient safety first, we can all work together to prevent this from happening again.